Okay, first of all, everyone, let me introduce myself. My name is Lee Kuhnfer. I'm the CEO of the BC Seniors Living Association, and welcome to another one of our educational webinars as part of our outreach and engagement series with our members. This morning we have part two of our Sanofi Pasteur-sponsored influenza series. For those of you who attended perhaps in the summer, we had Sanofi's medical director, Mile, give a presentation on the fundamentals of COVID-19, how the disease behaves, some of the best practices and procedures. Today, of course, we're going to be addressing the question of how to best prepare our sites to safeguard our residents and our staff members in light of the oncoming influenza season. Now, this is a period of unknowns for us, so the more information that we can deliver and push out to members, the better. But I think equally as important is the engagement of the members themselves in terms of taking advantage of these two presenters that we are so grateful to have this morning, who are going to be sharing not only guidance and wisdom, but also share experiences of their experience with what we will call the various health authorities' SWAT team or clear team activities in the event of a COVID outbreak. We never want to think about it, but we need to prepare for it absolutely. To that end, I'm very pleased to welcome Ajit Johal. He is the founder and clinical director of Immunize.io. He's a pharmacist by training. But more importantly, I think here today for us, his experience and guidance on the educational component and outreach in around the influenza season, inoculations, best practices, I think you'll find very valuable. We also have BCSLA board member Ernie He, and who's the Executive Vice President, Development Lifestyle Retirement. He has graciously offered to share his experience with a COVID-19, and I air quote this one, Ernie, for your benefit, the outbreak, as a health authority would call it. But I think Ernie will have some very important information to share with you of what to expect, as they say, when you get the call. Now, just for the format of today's webinar, I want to let everyone know that Ajit will be presenting first. However, what I'm going to do is I'm going to inventory any questions for Ajit and save them for later, as I know that Ernie, he has a hard stop, and I want to make sure he has the opportunity to get through his presentation and address any questions in real time. So what I would recommend you do, participants, is you have an ask questions or, a chat box, and that will be shown up on my screen and everyone else's as well. And what I will do, as best of my ability, pick out some of the questions that I think will generate some valuable conversation, or at least be relevant to the presenters this morning, and we will go that way. So Ajit will give his presentation, Ernie will jump in, we will then take questions in real time for Ernie, and then move to the questions for Ajit later at the end of the program. So without further ado, Ajit, I'm going to pass it over to you. The crowd is yours. We are all attentive and engaged, and let's get this going. Thanks again for being here this morning.
Thank you for having me, and thank you all of you for your commitment to your clients, your patients, and with everything that's going on. I think that's great that everyone's tuning in in the morning here to really find out what we can do and how best we can protect ourselves and our residents against the dual threat, is what we call it, with influenza and COVID-19. So we've seen the COVID-19 pandemic start in March, and now that we move into the fall, we're going to have to deal with influenza as well. So hopefully you'll find this presentation informative. It's called Protecting the Independent Senior, and it's what you need to know about staying safe this fall. So again, Lee was kind enough to put my biography out there. So special thanks to Sanofi Pasteur for sponsoring this presentation today. So we'll start with the relationship between vaccine preventable disease and disability. And I really want to focus on disability because it really resonates with what's happening in BC right now with some of the decisions that were made about funding particular vaccines, funding a lot of things when we look at what's best for those over the age of 65. So why is this demographic so important? Because we're experiencing demographic transition. You're all familiar with that, seeing the life expectancy increase and the total number of seniors in the province increasing rapidly, especially in the island and in interior health, where almost 25% of residents are over the age of 65. This may be due to the natural aging process, but also a lot of people from more colder parts of Canada start to retire out west. We're going to continue to see that grow. And this is also a national projection as well, with the population of those over the age of 65 projecting to double from 5 million about 5 years ago to almost 10 million in 2036. So really, when we look at it, we're going to see a unique time in human history where the world is going to have more older people over the age of 65 than children. So how do we add life to years, and how do we ensure that these productive and very important members of our society are continued to be looked after, and how do we get them the most vitality as we can moving forward? So according to Statistics Canada, the one thing that especially independent living seniors value most, and in general, anybody over the age of 65, is their independence and is their ability to keep doing the things that they like to do even into the golden years. So when we look at something called frailty, and I like to focus on disease causing disability, because when we look at sort of the clinical frailty scale, we see this sort of diagram here where we start with very fit, and then as we start to see more frailty, we start to see more dependence, not being dependent, but then we see more help with activities of daily living. So it's a natural process of aging, but can we prevent those modifiable and preventable risk factors that could send somebody who's over 65 down the frailty chain? And this is really important because as we see increasing frailty, we see increasing mortality. So as frailty starts to increase, mortality, the probability of survival decreases. So one thing that can certainly impact disability and frailty is an influenza infection. So if you're over 65, an influenza infection can lead to disability. So I call it along comes a virus. And a lot of people think of influenza as something, okay, I get a little bit of sickness, but for most people, it can be quite debilitating, especially for those over the age of 65. So many may not know this, but with the inflammatory response and the impact that an influenza or a flu infection has on the body, it actually increases the risk of heart attack, in particularly in the first 7 days of infection. So in the first 7 days of infection, it was found that the risk of heart attack was 6 times higher with those who were diagnosed with influenza. And it's thought to happen in the following way. When we see an infection come and sort of attack the body tries to fight back by mounting an immune response. And if we don't have a vaccine, it's kind of like an orchestra without a conductor. So different instruments are playing out of tune. So the body just gets into this overdrive mode, kind of like a cytokine storm, as you've probably heard. And what it does is it starts trying to kill the virus off, but in doing so, it actually dislodges plaques in the arteries, and that can cause them to travel to the brain or the heart to cause heart attack or stroke, with those complications leading to ongoing disability. So it's so much more than just getting the sniffles. It's a full body phenomenon that's often underestimated because it's just the tip of the iceberg with how much devastation and impact it can have on quality of life. So it is a well-known fact that pneumonia and influenza, and keep in mind pneumonia often is a secondary infection after influenza takes hold, and both of those are the third leading cause of disability. So with 15% of older adults hospitalized with influenza experiencing this catastrophic disability. So really, influenza prevention should be a priority and pillar in helping to maintain healthy and active living.
I don't know. I know Khadijah's been trying to get this set up.
Lori, I'm going to jump in here. Can I remind attendees to mute? Naheed, you just muted. Thank you so much.
No worries, thank you. So really, I have this infographic where it says vaccinated against influenza to prevent disability, which is a reflection of what we know of what these viruses can do. So on that note is what is the province doing in terms of influenza planning and vaccination options this coming season, with this season proving to be particularly challenging with the co-circulation of COVID-19 in the midst of a pandemic and a flu season that is upon us. So this is what the province has set forth. There will be no changes this year. There was support for what we call a universal program, where everybody is provided a funded influenza vaccine. But the province has maintained that they want to fund it again for those at high risk, which certainly includes those over the age of 65, and those capable of transmitting influenza to those at high risk. So that's frontline healthcare providers, household family members, those visiting those who are over 65. The problem, though, comes in more so is in all the options that are available for vaccination. So there's quite a few options and products available for influenza. So I always say, you know what, it's not just a standard vial that says flu shot. There's quite a few products that cover, you know, more strains, that provide more antigen. And how do you find out which one's the best based on your risk for influenza? So I kind of want to focus on the older adult population. So this is a picture of John Starbrook. He is the UK's oldest marathon runner. So Mr. Starbrook is over the age of 70, and he still runs marathons. And that's quite an impressive physical feat, because even myself, I don't run marathons because it's too difficult. But he's running marathons, and it just really shows he's a pillar of health despite being over the age of 70. However, one thing that we do like to point out is that even though those over the age of 65 are running marathons, the times are always longer than those in their 20s or 30s. So we see an increase in the time it takes to complete the marathon. And the analogy I like to draw with that is it's actually the inverse with the immune system. So we see this decline in the immune system at a certain point in time, so that even if somebody maintains their exercise, they don't smoke, they eat healthy, the immune system is something immunosenescence, as you age, your immune system ages with you, is something that is inevitable, and there's nothing that can be done to stop that process. So the reason why I bring this up is because this affects not only risk for disease, so if your immune system is declining with age, you're more susceptible to infections, but it also makes you less responsive to vaccines. So we look at the standard dose of an influenza vaccine. For those over the age of 65, it's quite a bit of a gap here that they're not getting the response that is happening in the body of those who are younger. So they're not as protected with a standard dose of a vaccine. So there's a couple ways we can look at this. There's two products in particular, and I won't go through all the products of influenza vaccines in Canada. There's an adjuvant and then there's a high dose. So the adjuvanted vaccine, also known as Fluad, contains an ingredient that enhances the immune response to vaccination. So in BC, for those over the age of 65, Fluad, which is an adjuvanted vaccine, is going to be available for those over the age of 65. Now, we are not sure of how much will be available. We do know that its release date is going to be a bit later, so it's going to be probably around November that publicly funded supply is going to be available. But that is one option that those over the age of 65 can do to provide better protection against influenza vaccine. But the best option that's nationally recommended and actually has been funded by the province for long-term care and assisted living is the high-dose vaccine. So it provides 4 times the dose of antigen for the immune system to work with. Note that the side effect profile between high dose and regular dose are very similar. There's no increased risk of side effects. So a lot of people ask, you know, if I'm getting 4 times the amount, does that mean I'm going to get 4 times the side effects? That's not the case. It's just going to allow your body, if you're over the age of 65, to mount a better immune response and kind of cover this gap a bit more that would be left if the standard dose vaccine was used. So the high dose vaccine is recommended nationally as being the preferred option for those over the age of 65. So that is sort of the preferred option for the over 65 age category to provide better protection against influenza-like illness, which is really important because we want to prevent influenza-like illness because we might think it's COVID-19. It's just a set of symptoms we want to do our best at preventing. Also prevents pneumonia hospitalization and all-cause hospitalization in general compared to the standard dose vaccine. So quite a few benefits of the high dose that we see in a large number of studies that have been ongoing for many years. So the BC government has provided a allocation of Fluzone high dose for those over the age of 65 living in long-term care and assisted living facilities. So that is provided upon the request of the facilities. They can order it and their provider could administer it for them, whether it's a nurse or a pharmacist, but it has to be at the request of the facilities. For those living independently, and I really think this is a very important demographic because we want to see people maintain their independence. So if they're independent living, that's fantastic because then we have more long-term care beds open. We want people living independently as long as possible. So independent seniors can access the high dose vaccine via private pay. It retails between $75 to $80, and it's available at some travel clinics and pharmacies. Unfortunately, due to the high demand of this vaccine and with the announcement on September 9th that the BC government finally recognized that this vaccine provides better protection, numerous other provinces had funded it before. This is BC's first season in doing so. There has been an unprecedented demand for the high dose vaccine. Availability is extremely limited, so it is going to be very difficult for those seniors living independently at this point in time to access the high dose vaccine. I'm going to go through some other sort of options near the end, but just something to bring to your attention because this is something that influenza vaccination should be done every season. So if there wasn't an opportunity to get high dose this season, it's something that the independent living seniors should certainly look at for next season. So we'll finish off with some strategies for older adults living independently and staff as well to stay healthy. And this is something that we at Immunize.io sent to all of our workplace immunization clients is how do we stay safe and healthy during the pandemic? There's been a lot of media around the first two, which is minimizing exposure to the virus and preventing virus spread to the community. So again, protecting yourself as well as protecting others by wearing cloth or surgical masks, social distancing, and washing your hands and not touching your face. But one thing that hasn't really been mentioned a lot is keeping yourself as healthy as possible. Remember that any sort of viral infection, there's a virus and then there's a host. So you can minimize your exposure and the amount of virus that you're exposed to, but as a healthier host, you have a better chance of fighting it off. So preventing the virus exposure, again, that hasn't changed over the past 100 years. Those interventions haven't changed since 1918 when there was the Spanish flu, our last global pandemic. And in 2020, you see the signage even a bit more sophisticated. It's exactly the same. Our public health strategies and sort of symptom management and how to deal with infectious disease haven't changed. But there are things that people can do for themselves. They can take control. Of course, these interventions are important at a population level, but we really want to focus on, as individuals, what can we do, especially if we're at risk for COVID-19 and influenza being over 65, what are some things we can do? So there's some things like exercise, diet, quitting smoking has a very good effect on health, taking medications regularly. These are all sort of lifelong interventions. Vaccinations are simple things that take 15 to 20 minutes, especially for flu every season, that can really help as a protection against bad outcomes this fall. So especially when we look at assisted living and long-term care, or even private residences, this is sort of a picture that kind of sets the stage for our next presenter, is that utopia is an imagined place or state of things which everything is perfect. So this is sort of your ideal residential picture where we have people coming in and out, visitations, having meals together, playing together, staff, their favorite staff, dedicated staff members on site, quality time is spent. So this is sort of your ideal scenario. And again, this is utopia, which is an imagined place where things are perfect. But ideally, this is the kind of experience we would want for residents living in any sort of residence or community. And unfortunately, when we look at outbreaks, this can disturb this quite dramatically. So COVID-19, most of the province in BC's deaths have been linked with long-term care and assisted living. Influenza, this has been happening for a long, long time. This is data from 2017, where 61% of outbreaks in BC occurred in long-term care facilities. So if infection control was poor then it's no surprise if a new virus comes along and we see the same thing. And if it's even worse, then we're going to see even more deaths. And the quality of life is really diminished. And that's something that I kind of want to end off in is quality of life is so important, because when we see pandemics, and again, this will set the stage for our next presenter talking about what the impact is when there is an outbreak in a facility. So this is a snapshot of influenza. So we have meals delivered to client rooms. People aren't eating together. And family visitations are limited, so that they can't have visitations, can't have social contact. Decreased staffing due to illness or quarantine, and ultimately decreased services with bed closures and decreased admissions. So it's quite a terrible scenario if it's an outbreak of anything that happens in a residence. So the most effective method of preventing flu, what is the best strategy moving forward this coming season? So now, unfortunately, we do not have a COVID-19 vaccine, but we do have an influenza vaccine that provides protection against the current strains that are out there. So ideally, you would want to look at if in long-term care and assisted living, try to use the high-dose vaccine. The government is funding it. All long-term care and assisted living should try their best to get their hands on some of the supply. I know it's in very high demand, and the province said that they ordered a lot, but in reality, it's never enough. But it makes a huge difference if we use a high-dose vaccine in a long-term care residence versus a standard dose. We prevent one hospitalization for every 69 to 70 residents vaccinated. That's huge. That's quite a phenomenal statistic. And even for staff, it's just so important to get the vaccination for themselves, because the standard dose, the high dose, at this point, whatever vaccination that you have access to will provide you some protection against influenza. And the more people that do it, then we get good vaccination coverage and we can contain infections. If we have poor vaccine coverage, one infection can spread through everyone in the sort of population or the cohort. And in long-term care, that tends to be, it happens in the form of an outbreak. So I would recommend all independent living residents, if they can't get access to the high dose, to get vaccinated against influenza, and all staff as well, because it's not just about protecting yourself, it's about protecting others in your community and in your bubble. So there's some other things that are really important, especially when we look at lockdowns and inability to visit. We want to make the environment that people are living in, their homes, more comfortable. So there has been some funding, and again, I'm not an expert on this topic, but there has been some funding for things like quality of life interventions. This may just be for long-term care, but sensory equipment, lighting, visual aids, music therapy, anything to make things more comfortable if there is a lockdown. I know even now there's strict infection control measures, but how do we make things more comfortable for residents? I think that's really important, and the government should certainly be looking at this. So with that, this is from the BC Care Providers website, looking at the perfect storm. So 30 years of underinvestment and COVID-19 really sets the stage for how we value independent living, how we value seniors care, in that we need to do more. And when we look at the vaccine perspective, vaccines are an important tool. We've seen what life is like when we don't have a vaccine, and the measures we have to take and the impact on people's quality of life and their mental health. So just because this is a co-pandemic influenza year, influenza is here every season, and we need to keep our foot on the gas, and we need to stay ahead of this. Even if next year, if COVID-19 is gone for some reason or it's mitigated, we need to continue to provide better influenza vaccine programs. Ontario, for the past 2 years, has provided high-dose vaccine for all adults over the age of 65. Other provinces have been doing it, and territories for those in long-term care for the past couple of years. Manitoba's been doing it for 3 to 4 years. BC just got on the bandwagon now in the midst of a pandemic. My greatest fear is that they will immediately just discontinue it the following year. We need to continue to make this vaccine available for those over 65, because we need every tool we can in this fight, and that vaccine is more effective than the standard dose for those over 65 in preventing influenza. So with that, I will wrap up and let Ernie take it away.
Okay, Ernie, before you begin, I just wanted to remind everyone that please get your questions in for Ajit. I know I have a couple here already for the end of the presentation, but also just a reminder that we are recording the proceedings here, and we'll be making it available to members in case any of your other sites or employees were unable to attend. But with that, Ernie, I pass it on to you. Thank you.
Thank you, and good morning, everyone. First of all, as a board member, I'd like to thank Sanofi Pasteur for organizing this. This is very important information, and we were a tag along to this webinar, which is already planned. I want to introduce our General Manager of Opal, Veronica de Conceso. If you could put your face on the screen, I can't see you, but what we wanted to do this morning, thank you, Veronica. So at our recent convention, which was almost a month ago, there was a request to share best practices, and ironically, the near miss that we had at Opal was happening right when the convention was starting. So there was some requests by some site members to share best practices. So we thought it would be very appropriate, and I put forward our site to give you, the site members, some experience as to dealing with the outbreak, as it's called in the press. So we hope by sharing our experience, you'll be better informed and prepared. Ajit said, this is inevitable. Numbers will indicate, just do the mathematical formulas. You may or may not get it, but the chances are sooner or later, something will appear. So don't think you're immune. Even the President of the United States got it. So I want to give you some background. First, Opal by Element is a new project. We're 158,000 square feet, located in Vancouver. We are 44 strata lots, which are owned by residents. We have 56 independent living leased units, 30 long-term care leased units. The secured second floor of Opal contains long-term care residents, and the management and operation of that long-term care floor and its residents is managed by an independent, experienced operator that we have engaged to do that. So Opal, before all this happened, had very strict COVID screening protocols in place. We had daily screening of all staff, thermometer camera, and contract tracing, which started right from the get-go. And even in the early days of COVID, we privately transported our staff to keep them out of the public transit system. So we thought we were quite a model child for preventing an outbreak. So our first call notification was on September 9th, and that was when we were notified that a spouse of one of the housekeepers of our independent contractor tested positive. We found this out over the weekend. We requested that the employee, who was the spouse of the person who tested positive, be tested. We were very cautious and wanted to be conservative. And ironically, under provincial protocols, because there was no symptoms, we didn't even really need to do that, but we did. Unfortunately, he tested positive on or about September 10th. Without symptoms, it could have been a false positive, but as you know, the government's very cautious, and so are we. He worked on the long-term care floor only, and was last on the Opal site on September 9th. Initially, he said he tested negative, and we all celebrated. However, he felt guilty and actually had misled us, so be careful. The lesson there that we learned was that, you know, the staffer felt guilty, but he's got to be honest and transparent. And as we learned later, he thought he would be discriminated against. So be careful. There's nothing you could do to prevent that. Just be aware that that can happen. So a false positive is one thing, but someone who misled us and lied is something you can't prevent. But it happened in our situation. Nonetheless, Vancouver Coastal Health was notified, and they placed Opal by Element, our great project, on its bulletin page. There's an outbreak site dated September 10th. Interestingly, this was immediately picked up by the media, and that day we were on the daily provincial update by Dr. Henry. I got home to see it on the screen. Not exactly a positive marketing event, obviously. We were told that the bulletin page, and that was our understanding, was for medical workers reference only. But it's very obvious that the media follow this, and they're all on notifications, because it was every news outlet. I had calls coming in, Veronica did, my president did as well. So under the provincial rules, the situation that we had was deemed to be an outbreak. And it's declared as an outbreak if a single case or possible case or even a possible exposure is reported. So clearly we weren't in agreement with being called an outbreak, bad nomenclature, but this is how the government categorizes it. We, at the time, and still do, express our disappointment and displeasure about this categorization, and we've done it with VCH and Dr. Henry's office. Much to our disappointment, the media picked this up and ran it as a story, and really without any explanation or comment from us. We think that was quite unfair, but it was toothpaste out of the tube, and you can't put it back. So now it appears, however, since we've talked to Dr. Henry's office and Vancouver Coastal Health and made this in writing on our objection, it looks like now the office, if you've watched the recent daily updates, clearly states if there's only one case, when an outbreak occurs at a seniors facility. So there's nothing that we achieved. It's now that they're being very clear that an outbreak could be one case only, as was in our case. So nonetheless, BCH sent its SWAT team, and it's known as the CLEAR team. And that, I found out, stands for Community and Long-Term Care Education and Resource Team. And that team arrived at our site on or about September 10th, right, Veronica? September 10th, I think it was when they arrived.
On the 14th, Monday.
14th, thank you, Veronica. So immediately they put some enhanced protocols in place, some of which we had in place already, but it's a long list. And so I'll tell you what they put in place, that some of which we did have. Face coverings for all staff on the long-term care floor, restricted access to the long-term care floor, no visitors to the long-term care floor, twice daily temperature checks for long-term care residents, and regular monitoring of long-term care residents for COVID-19 symptoms by the CLEAR team who were actually on our site. There was daily enhanced screening of long-term care staff. They also recommended, which we bought, extra PPE, some of which again we had on in our inventory, some of which we didn't. And that included masks, gloves, hand sanitizers, cavi wipes, isolation gowns, goggles, face shields, personals BP cuffs, isolation carts, waste bins, laundry bins, dissolvable laundry bags, overbed tables, disposable plates, cutleries and cups, and disposable serving trays. We took the position that we just went ahead and ordered that and bought that, and we have that in our inventory now. And I'd recommend that. So the balance of Opal, I want to be clear, wasn't affected. So our second term care floor is secure, and it's locked down, and we didn't have any positive case outside that spouse who was last on site. So as time went on, and we were now in our quarantine period, no Opal resident or staff member showed any symptoms or positive testing, and believe me, we were checking daily. The CLEAR team came to our site each day, and they remained on our site until September 23rd, and then left after there were no new cases or symptoms. We were told the employee who tested positive isolated and developed no COVID symptoms, we were told. Our restrictions were lifted on September 23rd. And what that means, I found out later, was we're still on the bulletin if you check today, but the red bold letter notification changed to gray. And it will remain on the site until 1 month has passed from the lifting of restrictions, which in our case is October 23rd. So what did we learn? What did we, and these are our comments, and none of them are political. Well, we felt that you have to deal with the situation, and which we've done, and we were very fortunate that we didn't have any more cases. But once there's a positive case, you're listed as an outbreak. We have tried to convince BCH and Dr. Henry that's unfair to our homes, but that's how they're deeming it. I noticed with interest that in the schools, they're calling them exposures as opposed to outbreaks. I think that's done for political reasons, but no comment otherwise. Dr. Henry told us, or her office did, that the reason they're calling it that is because seniors are more vulnerable and can't leave the home. So they want to use that very dramatic term. Clearly, as you can see or understand, that designation is very negative and brings negative thoughts to the media, the public, residents, and our staff, or your staff. And it impacts, obviously, the physical and mental well-being of our seniors and their families. So what do? Well, you have to stay calm. That's the one thing that we tried to do after being very angry when we got the call, emotional. One thing we've learned is you have to stay calm, but be ready to act quickly and decisively. We recommend buying the extra PPE, which we did, so you're ready, and tell everybody you did that, both the CLEAR team, which we did, and all of our residents and staff. Work closely with the CLEAR team. You know, I said this to Lee earlier, you know, when CRA knocks on your door and tells you it's an audit, or WorkSafe BC shows up because there's asbestos, those are two different things and everybody freaks out. But one thing we learned is the CLEAR team were very cooperative to help us through the problem.
Take the word
we weren't here being the big bad government. They came here, they helped us, and I would say cooperate with them. They're not trying to enforce regulations. They're trying to help us through the problem. You know, although we were initially angry with the employee, we recognized that, you know, at the end of the day, it wasn't his fault. Circumstances, his spouse got it. And so you have to, after the initial anger, you just have to bury that. And we told our service provider that although we were initially angry and disappointed with how we handled it, but, you know, stuff happens. And so remember that anger's okay, disappointment's okay, but it's not productive. You know, I always say to my team, there's the problem, and that's how you deal with the problem. And we recognize the problem, but I'm very proud of our team, how we dealt with the problem once we had it. You have to be transparent with your staff, your residents, the family, and the media. There was some talk in our organization, should we contact every one of the news outlets that ran our story? And I used the analogy of the toothpaste coming out of the tube. We just couldn't put it back in. And I didn't find that to be very productive. And we were just part of the news cycle because the next day another outbreak was declared somewhere else. So, you know, I don't advise reaching out to the media immediately. You might later, but it's a story they run and they get it from the bulletin. One thing that we did that I'm very proud of, we had a town hall meeting on September 18th, right? Is that the date, Veronica? 18th of September?
So, yeah. Yes.
And we did this with the cooperation of the CLEAR team. So we had a town hall meeting just for our residents, not their families here. And we were very transparent with them. We presented what we knew, where we were, what was hopefully going to happen. And we invited the CLEAR team to come down and speak and answer questions. And they did, and they were very good. And I'm very proud of our team for doing that because it relieved a lot of anxiety with our residents and our staff. So we invited our staff to attend that as well. And we opened the floor up for those questions, and it lasted almost 2 hours. But I think that was one of the best things that we did because it cleared up the air. It made sure that people understood we were being transparent and that there was nothing much more we can do than what we were doing already. And, you know, on that note, you have to make sure everybody in your company is on the same page, because all of us have friends, all of us have people we know. And I, like all of my team, got many calls from friends, business associates saying, what is going on? And you just have to make sure everybody's on the same song sheet so that the information that gets out there is accurately conveyed. And the other thing we took the opportunity to do was to tell our residents what we were doing and what we were doing in the future, because we'd already ordered some air purification system to come in. And so we used that town hall meeting to announce it, and people were very happy that we did that. So what we wanted to do, so that's our experience. There was lots of stuff in between. Veronica can answer questions better than I can about what happened on the ground or on the second floor or on the ground. You know, in closing, I want to, you know, just say nobody wants this to happen. And regardless, and we believe we had a very, very tight ship here and really controlled our situation in our site. It was very odd how it happened in our site. Once it had happened, though, you have to act cooperatively with the CLEAR team, with the government. You know, whether I like some of the things that the government did or doesn't do, as Lee knows and my board members know, you have to cooperate. We got through the problem. We're very grateful that we did. I consider us very fortunate that we did, that nothing more happened. So, as Lee and Ajit and I discussed earlier, what we'd like to do now is open it up to questions. I think Lee may have some in his chat room, and I'm going to ask Veronica to answer anything on the operational side as well. Veronica, do you want to add anything before we go to questions?
No, I just wanted to comment and echo what you were saying about the CLEAR team. They're really great in helping support the staff, and also really important to be really transparent and really staying calm. All the PPE that they suggested was something that they said you may never use it, but just to have on hand in the event that we do get an outbreak, we're just really prepared. But other than that, I think all the other things that we had in place was basically a model, he said, for all the other sites, what we had prepared. So.
Yeah, and then lastly, Lee and I talked about this before everybody jumped on the call. We're finding that each health authority is treating these things differently. So we're hearing. So we're in Vancouver Coastal Health. So I want to emphasize this has been our experience with the Vancouver Coastal Health, which is our authority. I can't tell you what's happening in Fraser or Island or the interior or the northern for that matter. So if there's somebody who wants to share that, if they've had an experience, but this is our experience with Vancouver Coastal Health, and we're very grateful for what they did and how they came in and helped us.
I mean, one thing that I do have to say is when we had to make that call to the health authority, you may not get your regional, for example, Pacific Spirit on the west side. We got someone from Fraser Health, which basically said to us that we didn't have to ask the employee to test for COVID. So I think it's really important operationally, we protect our staff and our residents to mandate and say and ask, yes, I don't care whether or not you're telling us not to test it because it may produce negative or positive results, or false negative positive, but what we want is to get that person tested so we can better prepare in advance what we need to do on site. So that's one thing that I would recommend, is to get that person tested right away.
Thank you, Veronica.
Okay, Ernie, if it's appropriate for me to jump in here, I want to thank you, of course, for your time. I know that you have a hard stop, so I want to get to some of the questions. I don't know who to address this one to, whether Ernie or Veronica or both, but the one question I had prior to this call even taking place is, how do you define the role of your staff and employees in terms of creating a sense of calm, a well-educated community, and what kind of role did your staff and employees play in terms of just creating that all-over sense of calm, or as best you can, a sense of calm atmosphere at the site?
Well, I'll go first and then I'll let Veronica jump in. It starts at the top, Lee. I think if you, and you push down, we operate here proudly as a team. And you, as a leader, you have to, show calmness. And I'm so proud of my GM for doing that, because it's very easy to run around the place like with your hair on fire. When you get it. And so the first thing we did, well, not the first, but we did a lot of things at the beginning, but one of them was to tell the staff that this is a team effort. Everything they do will help our team get through this problem. And we were very proud of how they did that. Veronica, do you want anything to that?
Well, I think a connection, and I think, coming from the industry and being in the industry for almost 30 years, I've had the opportunity to work with different employers. And I think this one element is a little bit different because people are so much more connected, maybe because we're small right now, and bigger companies don't always get a chance to connect with everybody. But I think, like Ernie said, it comes from the top. And we were able to, have meetings, talk privately as how we want to execute information. And I'm pretty calm with scenarios as such. And it's just emulating the calmness to the staff and telling need to know basis, basically. But at the same time, divulging what needs to be divulged at the right time and not panic. And that's how we've been able to get through it.
Right, thank you for that. I appreciate it, because as we all know, during circumstances like this, even more so, the role of staff and employees becomes all that much more important. They are already, let's face it, but in times like this, it's good to have a coordinated and cohesive approach. Another question I have here in front of me is either Ernie or Veronica. In terms of what the CLEAR team recommends in terms of any practices or procedures that they recommended that weren't already in place, are there any that you're finding were useful, helpful on a go-forward basis as well, outbreak or not?
Yeah, I actually found that when they recommended separate laundry bags outside of the resident suite and also one inside, just because when they told me that, I couldn't quite understand, well, why would we need that right now? And he says, well, it's just in case you have an outbreak. It's like being in a hospital for people under isolation, where when you visit a loved one, you're going in, you're gowning outside the clean gowns, and when you leave, you're throwing or disposing the used gowns in a laundry cart inside. Right? So that was helpful to me. I couldn't understand why we needed all this stuff right away, but it's just an event. There is an outbreak and people need to isolate. Also, why they needed to be here only, I think it was like 8 days rather than, let's say, a month. And they said, well, if there are no other symptoms, we don't need to be here. But they guided us as to, proper temperature taking, hand washing. They were physically here monitoring our staff. So that was very, very helpful, I found, and what I learned.
Great, thank you for that. And just to Ernie's point earlier, he's absolutely correct. We appreciate you sharing your experience with Vancouver Coastal Health. But what we have found as we are going through this, and perhaps it was a practice that existed pre-COVID, but health authorities not only receive but interpret directives, guidelines very differently. You can have one message come out of the Center for Disease Control only to have it interpreted 5 different ways and implemented 5 different ways. So for those who are on the call, I wanted to just communicate again that this issue has been raised in the COVID-19 working group. We have made some progress in terms of elevating the concerns from the 3, what I would call seniors living associations, both BC Seniors Living Association, Denominational Health, and the care providers. We have jointly approached the Deputy Minister of Health and his team of ADMs, where discussions are now occurring with the BC Centre for Disease Control for them to take a firmer approach, a more proactive approach in terms of how health authorities are implementing guidelines, because I do know We have situations at the Fraser Health Authority, for example, where their infection prevention control audit tool is far too prescriptive. It requires procedures to be put in place for independent living that are, by letter of the law, not possible. So there are certain issues we are working on in that regard. But I would like to take the opportunity just to remind people, if you do have any questions, feel free to use the chat box or to on the list of participants. If you don't want the question public, just send it to me directly. But the one other question I did have, and again, Veronica or Ernie, I'll leave it to you as to who responds. But in terms of I know that Ernie, you touched on the approach of contacting family members or prospective leads in terms of new residents. Can you just go over again the process that your team employed to, again, not only reassure loved ones and family members, because we know that they're an important part of this equation as well, but again, from a marketing standpoint, how did you approach that? And again, I open that up to both yourself and Veronica.
Well, I'll start, and then Veronica can get into some more details. But the bottom line is, please don't hide any of what's going on from either your residents or prospective candidates who, during this time, actually continue to contact us. So, Veronica, you can share you've told me this, that not only with residents and with staff, but people inquiring, we were very transparent.
Yes, and of course, when it happened, I was bombarded with phone calls for 72 hours. We have some families that have other families that live on the licensed care. So naturally, they would tell each other. There were screenshots of the media that were sent to me, and there are some families that need a little bit of TLC, I would say. So I made it a point to actually contact the families personally and explain to them what had happened. And they were a little bit more at ease, because naturally the media tells a very different story, especially when they put a comma after opal by element outbreak and then comma, 97 cases in long-term licensed care. So it naturally looks like we had 97 residents infected by COVID, which is obviously not the case. So it was a lot of phone calling and reassurance to the families. Some of the residents as well, I personally connected with, because I know either A, language barrier, second, just not knowing, and so I connected with them as well. It's with regards to marketing, of course, those we have on the queue or deposits, they naturally called in, so we explained it to them. Despite all of that, we still have residents eager to move into Opal, but I needed to be transparent with them as to what exactly is going on. They know, some people are actually not really worried, and others a little bit more anxious. So we do, in terms of sales and marketing, I do let people know, those that are on the queue with us, and also those that are calling in and then inquiring.
Okay, thank you very much. That is the end of any questions from the participants. Oh, sorry, Ernie, do you want to step in?
Yeah, I just wanted to add something. We were in the middle of an advertising campaign that some of you may have seen on TV, and so we made the decision when we were in the middle of this that we kind of put a pause on that, because it was ironic that we were in the news and yet we were advertising. So something you got to think about as a company or as a site, if you ever get caught in this situation, what you're advertising, what you're marketing out there. So we're back actively, obviously doing it now, but we had to take a look at that, because it would have been kind of ironic that we were advertising our lifestyle and we were in the middle of an outbreak, according to the province. So be careful of that. That's where there's kind of mixed messages going on there.
Yeah, and I also wanted to just sort of add a little piece here in terms of the process and how it all the information gets relayed. It's really important for those sites that have licensed care to ensure that the licensing office understands that the information that we want that only applies to licensed care is messaged, because I had to call the licensing office 3 times to correct them that the information that they have public is incorrect, and not to just indicate that it's OPAL by element, which looks like our entire site has been infected with COVID, or even with 1 case, but rather that it is concentrated on our licensed care area only. So you have to really watch the facility outbreak bulletin on the Vancouver Coastal Health site to ensure that the message that you want posted is correct on their website. And sometimes, for whatever reason that happened with us, that information was not relayed properly. And when the medical health officer is on site, the process is that, you know, he will declare whether your site is on outbreak. And if it does, then he goes to the Ministry of Health, and then the Ministry of Health actually communicates to the Vancouver Coastal Health communications team. And that's when the team relays the message out to the public. So there is a process, and then vice versa, or the same process happens when they declare your outbreak over.
Right, thank you. I guess the message, the takeaway there is to be vigilant, be proactive, and engage with the licensing department, but also with the CLEAR team. Also, I appreciated your comments, Ernie and Veronica, about transparency and engagement of staff and employees in the process. There are some things that you shouldn't try and spin a story, so to speak, where honesty truly is the best policy, and you move forward collectively on that front. So I think that message, again, is much appreciated. I don't have any more questions in queue on this front, but by all means, while we are on the webinar, feel free to send in some questions. I would like to pivot shift.
Sorry, Lee, I've got a question here.
Sure.
Yeah, a good question just came in to me from somebody on the webinar listening privately. Great question. It says, for older adults living in independent living retirement communities, not able to easily access Fluad or Fluzone, do you recommend getting the flu viral now? The community is having clinics on October 16th and 24th to protect them until they're able to access Fluad or Fluzone later in the season. That's a great question. So the way we want to look at this is that, given that it's difficult to access these vaccines, with obviously Fluzone being overwhelmed with demand in the private market, and with Fluad with its launch date later in the season, it's in my professional opinion that if access to a vaccine is a challenge, we want to take vaccination over no vaccination. So those who can attend those clinics, even if it's with the standard dose, it's better if we all get vaccinated against influenza than to wait and potentially miss out on something. Furthermore, we don't recommend multiple vaccines in a season. So if you have one of these vaccine options, there's no need to get an additional vaccine if it does become available. The other thing I want to mention is that the funding for the high dose that came into the assisted living and the long-term care, that was done from a federal funding position. So the province still has not kicked in any funding for any adults over the age of 65 for a better influenza vaccination option. So I think that's something that everyone should be mindful of coming into future seasons, in that if this is just a one-time federal grant, I don't think that that's a good way of doing things. We need better infection control across the board. Even in the midst of a pandemic, it just kind of, like Ernie and myself had mentioned, it just kind of illuminates the cracks that are there. There's no, just because they're illuminated doesn't mean we can ignore them if the light is gone. We need to fix those and provide better infection control measures. And one of them is more effective vaccines for those at risk.
Right, no, that is a good question. I did see that in queue and was going to move to that, Ajit, but thank you for jumping in. The one thing I will say, Ajit, and perhaps I will let you talk to this. Would it be possible for you to just forward contact information? It's not that I want to inundate you with calls, but perhaps some contact information where people can get a hold of you directly, either to access the high-dose flu vaccine through you or your organization, or for you to be able to direct them to the appropriate areas. Would that be a possibility?
Yeah, absolutely. I think email is the best way to reach me. And then I think it might, yeah, feel free to share that. It's ajit@immunize.io.
Got it. That I will do when we send out a follow-up recording, et cetera, with your information as well. I did get another question that goes back to the Element Living. So Veronica, you're not free to go just yet. And Ernie, I did get a question around when the outbreak was announced and the Clear team came on site. Were there any? I noticed that we have some associate members on the call as well. So perhaps it'd be appropriate to direct some questions in regards to in and around the provision of services to the site, whether it be food services, whether it be other outside contracted out services. Was there anything particular you had to do in order to accommodate those services or stop them altogether? If you can share your experiences around that side of the equation, that'd be appreciated.
Well, I think that with food services, of course, being necessary, we'd always had protocols in place for screening. But you know, some of the services, as you know, we're a new building, and we from time to time have contractors come back in. We have contractors either going through suites or fixing issues under warranty. So we stopped all that while we were into the outbreak, Lee, and for others on the call. But for necessary services like food services, we just continued to screen and make sure we had all of our safety protocols in place. Veronica,
And I'm happy to share with everyone later or email it to you, Lee, if you should see fit to email everyone on BCSLA. But there is a screening protocol that Vancouver Coastal Health issued on top of our screening on site. So I can email that to you if you like.
Absolutely, that would be appreciated. But again, we need to be mindful of that might be a requirement in Vancouver Coastal Health, but not a requirement in Fraser Health or Vancouver Island, et cetera, but that would be much appreciated.
Okay.
Another question I have, and Ajit, this one is over to you. When we talk about inoculating someone or immunizing using the high-dose flu vaccine, because there are 4 times sorry, I can't remember the proper terminology, but anyways, is there, on the side effect side of things, you said they are no different, but are there certain things that someone needs to do should you be immunized with the high-dose flu vaccine? Are there things you can do to ensure that perhaps your system isn't hit so hard after the immunization, or that you transition out of the immunization much more effectively?
You know what? Actually, it's actually dealing with like the immunosenescence phenomenon that I mentioned. So really, there shouldn't be any sort of difference between the regular flu shot and the high dose flu shot in terms of tolerability, because we're just bridging the gap of what a normal response would be by just giving more antigen, as I mentioned, to work with to mount that immune response. So I think we do get it confused sometimes with the Shingrix vaccine, the new vaccine for shingles, which is quite immunogenic. So that's got sort of that gives a very strong immunogenic response that makes people feel uncomfortable for a few days sometimes. But between the high dose and the standard dose, really, we don't counsel anybody any differently based on the usual post-injection side effects. So all the data that's come through, there's no statistical difference between the side effects. And in my practice, I've been providing high dose for a couple of years now. I haven't seen anybody who's had any issues with it just because they're getting 4 times the amount. It just mounts a better immune response, but people don't necessarily feel that.
Okay, thank you. And there's one last question here on, again, in and around the immunization. Given the fact of the high-dose flu vaccine, the higher number of antigens, is there a longer time for the body to produce antibodies? Is there a longer post-immunization period for when your body has actually produced the antibodies?
That's a great question. So no, there isn't. Usually for all influenza vaccines, we usually counsel to say it takes about 2 weeks to have your antibodies fully circulating to combat flu, which goes to my point that the sooner you get it, the better, because then you are protected sooner. So there's no difference between the standard shot or the high dose. We still have that 2-week period where we would expect maximal antibody.
Okay, I'm going to keep you online here. Ajit, there's another question came in. Is it true that the flu vaccine should be given to seniors at a later time, such as end of November, so that it can last a little longer into the following year?
Yeah, so you know what, there isn't any sort of data or evidence to support having a flu shot later. We know that flu season will probably begin probably around late October and run all the way into the winter and into the early spring. So the only thing we do know is that it takes 2 weeks to build antibodies against it. So sooner the better. Of course, access is a challenge, demand is a challenge, but there's no benefit to waiting to get it because you're basically still exposed. So there's no data to suggest that waiting later to have more protection later in the season. We have more evidence to look at doing it sooner to have protection sooner.
Okay, I thank you for that. So that at the end of the day, the message is, don't wait, do it now if you can. So that is much appreciated. I know that we're just past the hour mark. We did book it for 2 hours, not knowing how many questions we would have. But I do not have any other questions in the queue, and we have covered the questions that we got prior to the call. But so I would make one last ask to participants. If there's anything that you would like to ask while we have the gracious Ernie, he and Ajit and Veronica online for us to take any questions directly. Let's not use this as a one and done opportunity. If there's any other follow-up questions that you have, feel free to email me, lee@bcsla.ca. This session is being recorded, I believe, and will be forwarded out to not only the participants but members. And I will be sure to include Ajit's contact, the email information, so people can ask questions of him directly. Ernie or Veronica, would it be agreeable if I was to give one or both of your emails as well?
You can give mine.
Absolutely.
Yeah.
I will do both. So with that, everyone, I do want to thank you for your time and your attention to this. Your engagement is very important, but at the end of the day, Ernie, Ajit, and Veronica, thank you so much. And thank you to Sanofi Pasteur for making this possible. These educational webinars are truly helpful, particularly in these times. And I know that in Ajit's presentation, he talked about some of the dynamics that change on site in flu season, but even more so with COVID-19. And one of that was in and around dining experiences and socialization. Just for those of you on the call, the next webinar we will be having, and that information will be coming out to you shortly, will be a webinar on dining practices and procedures and meal preps assistance from the fine folks at GFS who have put together a webinar for us. So look out for that in your email. And with that, I would just like to wish everyone a safe and great day, and thank you for participating. And again, do not hesitate to reach out to either myself or Khadija or Sani in the office, anyone here. Happy to help. And like I said, we will get that recorded presentation out to you as soon as we can with all the contact information.
Stay healthy and stay
Thank you very much, everyone. Have a great day.
Thanks, everybody.
Bye.
Thank you, everybody. Bye.